What if I told you there's a dangerous condition silently damaging your body right now, and you feel absolutely nothing? No pain, no symptoms, no warning. That is exactly why doctors call it the silent killer. Right now, nearly half of adults in the United States is living with high blood pressure, and nearly half of them have no idea. Stay with me, because what I'm about to share with you today could genuinely save your life. Why is high blood pressure so dangerous? Your heart beats approximately 100,000 times every single day. With every beat, blood travels through your arteries under pressure. Now imagine that pressure is consistently too high. Think of it like a garden hose. Turn the pressure up too much, and over time, the hose weakens, cracks, and eventually bursts. That is exactly what uncontrolled high blood pressure does to your body. Slowly, silently, over years, it damages your heart, your brain, your kidneys, and your eyes. And the most alarming part? Most people only discover it after a heart attack or a stroke, when serious damage has already been done. That's why today, I'm walking you through 5 silent warning signs your body may already be giving you. Sign number 1, morning headaches. Do you regularly wake up with a heavy feeling or a dull ache in your head? Most people blame poor sleep or dehydration, and sometimes that's all it is. But a headache that consistently appears in the morning, particularly at the back of the head, can be an early warning sign of high blood pressure. Here's why. During sleep, blood pressure naturally decreases. But in people with uncontrolled hypertension, this drop doesn't happen properly. Pressure continues building in the brain's blood vessels throughout the night, and you wake up in pain. According to research published in the Journal of Hypertension, morning headaches are significantly more common in people with poorly controlled blood pressure. If this is a regular pattern for you, please get your blood pressure checked. Sign number 2, vision changes. The eyes are the only place in the human body where a doctor can directly observe your blood vessels without any procedure or surgery. High blood pressure puts significant strain on the tiny, delicate vessels inside the eyes. Over time, this can cause a condition called hypertensive retinopathy. Watch for these symptoms: blurry or hazy vision, flashes of light, dark spots or floaters in your field of vision. If these symptoms are occurring repeatedly, do not dismiss them as simple eye strain. Your body may be signaling something more serious, and an eye examination can actually detect high blood pressure before you even know you have it. Sign number 3, frequent nosebleeds. Most people consider a nosebleed to be minor and unrelated to heart health. But if your nose bleeds without any injury, impact, or known cause, and this is happening repeatedly, it may be a sign that blood pressure is elevated. The tiny blood vessels lining the inside of the nose are very fragile. When blood pressure is consistently high, these vessels can rupture under the increased force. This doesn't mean every nosebleed is caused by high blood pressure, but frequent, unexplained nosebleeds are something a doctor should evaluate. Sign number 4, shortness of breath. Do you find yourself getting out of breath climbing a single flight of stairs, or after a short, gentle walk? When the heart is forced to work against persistently high pressure, the heart muscle gradually weakens, a condition called hypertensive heart disease. A weakened heart cannot pump blood efficiently, which means the lungs receive less oxygen than they need. The result? Breathlessness during activities that should feel effortless. This symptom is very commonly dismissed as a sign of aging or being out of shape. But in reality, it can be your heart telling you it is under serious strain. If this is happening to you, please speak to your doctor. Sign number 5, ringing in the ears. Do you occasionally experience a ringing, buzzing, or humming sound in your ears with no obvious external cause? This is called tinnitus, and research has found a significant association between tinnitus and high blood pressure. When blood pressure is elevated, blood flow through the small vessels of the inner ear can become turbulent. This creates an audible sensation that has no external source. It is important to note that tinnitus has multiple possible causes. However, if it occurs frequently and no other cause has been identified, getting your blood pressure checked is a sensible and important next step. What should you do right now? Here is the genuinely good news. High blood pressure is one of the most manageable and treatable conditions when it is caught early. These are the 5 most evidence-based steps you can take starting today. Step 1. Get your blood pressure checked today. A normal blood pressure reading is below 120/80 millimeters of mercury. A reading of 130/80 millimeters of mercury or above is classified as high blood pressure according to the American Heart Association. You can check it at your doctor's office, a pharmacy, or with a home monitor. It takes less than 2 minutes. Step 2. Reduce your sodium intake. The American Heart Association recommends no more than 2,300 milligrams of sodium per day for most adults, and ideally 1,500 milligrams per day for those already diagnosed with high blood pressure. This means reading food labels, reducing processed and packaged foods, and cooking with herbs and spices rather than added salt. Step 3. Walk for 30 minutes every day. Regular moderate exercise is one of the most powerful lifestyle interventions for blood pressure. Studies published in the American Journal of Hypertension show that consistent walking can lower systolic blood pressure by up to 5 to 8 millimeters of mercury over time. You don't need a gym. A 30-minute daily walk is enough to make a measurable difference. Step 4. Monitor your blood pressure at home. Purchase a validated home blood pressure monitor and check your reading once in the morning and once in the evening. Keep a simple log and share it with your doctor at your next appointment. Home readings are often more accurate than single clinic readings, and they help your doctor make better decisions for your care. Step 5. Manage stress actively. Chronic stress is a well-established contributor to elevated blood pressure. Research shows that practices such as daily mindfulness meditation, deep breathing exercises, and even 10 minutes of calming music can produce measurable reductions in blood pressure over time. Stress management is not optional for people with hypertension. It is part of the treatment. High blood pressure isn't called the silent killer because it's impossible to detect. It's called that because most of us don't pay attention until it's too late. But you are paying attention right now, and that matters. The information you've learned today, these 5 signs, these 5 steps, this knowledge is genuinely powerful. Please share this video with someone you care about who is over 40. It could make a real difference in their life. I'm Dr. Ava, and I'll see you in the next video. Take care of yourself. You deserve good health.